Do you get stiff hips after sitting for a long period of time? Or do you find it hard to stand up or straighten up for the first couple steps while walking? If any of those apply to you, in this video, I'll share some tips to help stop hip stiffness when sitting, plus some exercises to prevent it from happening in the future. Now, many people think that hip arthritis is the cause of stiffness when sitting. However, it's not the primary reason why people get stiffness. Many people without hip arthritis get hip stiffness when sitting, and many people with arthritis can sit quite comfortably. So the most common cause of stiff hips when sitting is actually your hip flexors. And that's because when you're sitting for long periods of time, your hip flexors are in a shortened position. But everyone's hip flexors are in a shortened position when they're sitting. So why do some people get stiffness and other people don't? Well, largely a lot of it has to do with how you're sitting. If you're sitting up with good posture, trying to sit up tall on the edge of your chair, your hip flexors, which attach from your spine down to your femurs, are actually acting as a postural muscle to help hold you up. So if you're trying to sit up with good posture like this, your hip flexors are in a shortened position and they're constantly under tension, acting as a postural muscle. Conversely, if you sit back in your chair, relax into the backrest or slouch, so to speak, it allows your hip flexors to relax. So while they're still in somewhat of a shortened position, they're not under tension. And you don't develop knots or trigger points so that when you go to stand up, it's easier to straighten up your hips. Now, what if you have lower back pain and you need to have some arch in your lower back? Well, in that case, you can use a towel roll or a lumbar roll and place it in your lower back up against the chair. This helps to passively maintain the curve in your lower back without having to kick on your hip flexors to help hold you up in a spinal neutral position. Now, there's another hip flexor muscle that can cause hip stiffness when sitting, and that's called the tensor fasciae lata. The tensor fasciae lata is a little muscle that sits on the outside of the pelvis and connects into your IT band. And that can cause IT band syndrome in your knees. It can cause outer hip pain. It can even cause a burning pain in the outer side of your thigh called neuralgia paresthetica. So although it's a small muscle, it can cause some pretty big problems. And the tensor fasciae lata is a hip flexor, it's a hip abductor, and it's a hip internal rotator. And people who sit with their knees knocked together like this in hip internal rotation are most likely to develop stiffness in their tensor fasciae lata when sitting for long periods of time. Again, particularly if you're using it as a postural muscle to help hold you upright. So it is helpful to sit with your hips in a neutral position or even slightly externally rotated like that. That helps take tension off the tensor fasciae lata. And if you're sat back up against the back support, it also helps take tension off your other hip flexor muscles, your iliopsoas. Now, how you go to stand up from sitting also plays a role in how much stiffness you're going to experience. From a front view like this, you want to try to keep your hips, knees, and toes in alignment. You don't want to allow your knees to knock together like that when you go to stand up. And to do that, that requires using your gluteus medius and gluteus minimus, as well as your hip external rotators to help keep your knees turned out as you go to stand up. Now, from a sideways view, when you go to stand up, remember you want to be starting from the back of the chair, but you actually want to scoot to the front of the chair when you go to stand up. This allows you to get your center of gravity out over your feet, which allows you to stand up more comfortably. Now, as you go to stand up, if you go all the way up like this and your hip flexors have been in a shortened position for a long period of time, it may feel a little bit uncomfortable. So sometimes it's helpful to come up about 80 to 90% of the way, take a small step, and then roll your pelvis underneath. That stretches the hip flexor on this leg, or to see it from the other leg, you hinge forward like this, get your weight over your feet, come 90% up, take a step, and that stretches the hip flexor on that leg. Then you can progressively straighten up over your first couple of steps. So that helps with hip stiffness when you're sitting, as well as to stand up more comfortably. But how do you prevent the problem from happening in the first place? Well, again, you want to pay attention to your sitting position, but there are some stretches and exercises that you can use to prevent muscle imbalances in your hip. When you flex your hip or bring your knee up like this, the hip rolls in this direction, but the ball has to glide backwards in the socket in order for the ball to stay centered in the joint. And if you have stiffness in the back of your hip, that prevents the ball from gliding backwards. You can get some pinching in the front of your hip, again, particularly if you're sat forwards like that. So stretches to improve stiffness in the back of the hip include bringing your knee up towards your chest like this. You can do this in a sitting position in a chair. You can also do it lying on your back in the floor. Doing a piriformis stretch. This stretches the hip rotators in the back of the hip. Pushing down like that and holding for a minute or longer. That can help with stiffness in the back of the hip, which again prevents pinching or pain in the front of the hip when you're sitting. Additionally, doing a different version of that piriformis stretch, crossing the leg and pulling towards the opposite shoulder. This hits a little down lower in the buttock and helps stretch out the back part of the hip, again, so that ball can glide backwards in the socket. Now there's some other exercises if you are able to get down on the floor. Doing an all fours rocking stretch like this is often very helpful. Now, unlike a child's pose where you go down and stretch out your lower back, you actually want to keep your lower back in a neutral to slightly arched position. This way you force motion to come from the hip joint rather than rounding out the lower back. So sit back with your spine neutral to slightly arched, hold for about 10 seconds, and then come back forwards, and then rock back, hold for about 10 seconds, and then come back forwards. If you have stiffness in your hips, you will likely feel a bit of a pinching in the front part of your hips, and that's okay, but you don't want to go past that. So just go right up to where you feel that pinching, but not to the point of pain. Hold it, and then come back up. This stretches out the back part of the hips, as well as uses your body weight to help mobilize through the thigh bone, pushing back that way. Now, if you can't get on the floor, there are some other exercises that you can use to improve the hip joint mobility using bands. And you can check those out in this video over here. Before you go do that, if you found this one helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.